Hi, everybody. Welcome to PO Sinners. My name is Gozi. In this video, I want to talk about five things I would consider if I was going to take a home healthcare contract. I'm actually looking for a home healthcare contract right now. I'm looking to do one soon, time permitting. So I was thinking to myself, based on my experience doing home healthcare full time, what would I look for in a contract? So I came up with these five things. So the first thing I would think about is territory. Like, what areas would I be covering? Am I going to be covering multiple areas? Because it's going to affect my workflow. So, regardless of how much I'm getting paid, if it's going to be stressful, driving all over the place, I have to consider if the contract is worth it. If I'm covering five cities and the distance between all five is vast, I'm kind of going to be driving all over the place. And then you have to consider, well, how many patients am I expected to see if I'm going to be driving all over? You have to consider it's an 8-hour workday. Um, if I'm going to be seeing seven patients, right? And if I have to see seven patients a day, um, you know, how much time am I spending with each patient? Even if you're spending 30 to 45 minutes with each patient, that's pretty much your 8-hour day, just the time spent with the patient. You haven't considered drive time. It's going to take you time to drive from patient to patient. So, like, how many hours are you going to be working? Are you going to get paid for those hours? What would your responsibilities be? All of those things are going to be affected by how much time you spend on the road and how much time you spend with each patient. So it's important to know what territories you're going to be covering, and you can take the contract or not take the contract regardless of the territory. If you're going to be covering 10 areas, if you're okay with that, you can take the contract. But you have to keep in mind that the amount of areas you cover will affect your workflow and your ability to meet productivity for the company that's hiring you. So, this is something I feel like you can negotiate. It should be negotiable, reasonably so. You can say, well, if I'm going to be covering these areas and you say I have to see seven patients at the minimum a day and I have to spend a maximum of up to 45 minutes with each patient and I'm working an 8-hour day, how would I drive to two or more of these cities in good time and see all these patients and meet productivity? Is it possible that I can cover two areas that are close to each other or three areas that are close to each other? And on the occasion that you need me to go out to all of these places, perhaps we can work something out. But you have to get like something like a base territory in your contract so that if push comes to shove and you have to say, well, I don't cover that area, I can't go there. If it's going to mess up your workflow, it won't cause any conflict because it's already in your contract. So that's something to think about. The next thing I would consider are my responsibilities. What am I going to be doing? So, like I said before in a previous video, in home health care, depending on the kind of agency you work at, you could do one thing or multiple things. In some agencies, you just do the regular visits where you have to see like maybe five, six, seven patients a day. Or you could do regular visits, do admissions, do discharges, do recertifications, do resumptions of cares, do wound care, do everything basically. So the more your responsibilities are, the more time you're likely to spend with the patient depending on what you are doing. So if a patient gets wound care twice a week and all you have to do is go in there and assess the patient and you're out, you spend less time with the patient. But if you have to go in there, assess the patient, and do wound care, it's going to take you more time. You're going to spend more time with the patient. And remember, you have other patients to see. you are kind of on the clock to meet productivity. So your responsibilities will affect your workflow, and that will in turn affect your productivity. Now, some places they work the way they work, so your responsibilities might be non-negotiable, except in places where you know you don't have the skills. So let's say, for example, you're required to do wound care. Okay, if it's a simple dressing, maybe you can do it. If it's something like a wound vac that you've never done before, you can say, I'm not competent in doing wound vac changes. I haven't done it before. I'm not trained on it, so I can't take your wound vac patients. They might offer to train you, because if you have that skill, it benefits them because they can send you to any and all of their patients. So it's up to you to say, okay, I'll take the training, I'll shadow a nurse, or, I would rather not. But it's always good to increase your knowledge and invest in yourself, knowledge wise. And the education is free. So, like, why not? But it's something to think about. The more responsibilities you have, the more time you might have to spend with each patient, and it may affect your workflow. The next thing I would think about is the pay, in a sense. So, of course, your pay is going to be hourly. And some of these home health care jobs can be quite time intensive. But I doubt that they'd want to pay you overtime, because if they expect you to work 40 hours and see all their patients within the 40 hours and do all your documentation within the 40 hours, and you're spending 60 hours, they're not making money because they're paying you extra. Most likely they won't want to do that. So I would ask about overtime. Do you pay overtime? And just kind of gauge what their um, culture is about overtime. They might say, well, we pay overtime, but we expect that, you get your work done within the time allotted to you, 8 hours a day. You should be able to see all your patients within 8 hours, within an 8 hour workday. Now, if they give you multiple territories, you can say, well, if I'm going to be seeing patients that are scattered all over the place, it's going to be difficult for me to see all of them in 8 hours, especially if I have to spend at least 45 minutes with each one. My 8 hour workday is pretty much eaten into just by the visit time only, without talking about the drive time. Do you pay any kind of overtime at all? They might say, well, you know, we might pay you up to, you know, an hour a day, 2 hours a day. You just kind of gauge what their attitude is towards overtime. And that will tell you, how to kind of invest your time into this job. Or if you need overtime, you need extra hours, it might tell you, okay, I might need to get some other job for the weekends or something like that. Now, some agencies will require their full time staff to work weekends, but you are going to be a contract staff. If you want to put on your contract that you will work weekends, it's okay, but then you will be contractually required to work those weekends. If you want to pick up weekends, it's a different ball game altogether. You could put in the option that you can pick up weekends if you want. And then they can tell you what their weekend rates are, and then you decide if you want to pick up any weekends. But look at your contract before you take it. It might be in there that you're required to work weekends. Okay, so and then some other jobs you could pick up while you're working that home healthcare contract, if they agree, is on call. You know, you might pick up on call hours at nighttime, after hours, on the weekends, and they should pay you extra for that. But you're a contract staff, so you shouldn't have to do all this extra stuff. Your contract shouldn't say you have to do on call hours so and so. I mean, you could say that, but these are things that you can negotiate if you want to. Um, I feel like if you're having to work 40 hours a week, now you must do on call, now you must work some weekends, it might start getting a bit much. So that's something to think about. Productivity is another thing I would think about if I were no. I think about it because I'm thinking about taking a home healthcare contract. I think about productivity, and I would ask, what are your productivity criteria? How many points a day, how many points a week, what kind of patients do you have, what kind of points do you assign to each patient? And I feel like productivity ties into territory, maybe everything, because if you're driving in a wide area, it takes time to drive from place to place. The drive time, parking time is going to cut into your um kind of productivity time, or time you trying to use to hit productivity benchmarks. So I would ask, what's the productivity, and kind of now be like, okay, here's what your productivity criteria is. It's going to be difficult to hit if I'm covering this large area, but if you give me one area, two areas, I could probably hit this your productivity criteria. Or, it's good to know so that you can kind of plan yourself so that you can hit their productivity for the day and their productivity for the week, or see if it's something that you can actually hit based on everything else that they're going to tell you is involved in the job. So productivity is important to know. And finally, I think the last thing I would consider if I was going to take a home healthcare contract from a company is mileage. Um, will they pay mileage? Because you're going to be putting miles on your car, and a lot of agencies do pay for mileage. Now, what I don't know is if they pay their contract staff mileage, because I haven't done a home healthcare contract yet, but it's something I would ask about since they pay to their full-time staff. I'll ask, do you pay mileage, and how much do you pay for mileage, and how does it work? Because remember, they don't pay you mileage to drive from your house to the first patient. They pay you mileage for driving from the first patient to the next patient. But if you drive to the office, to their office, and then from the office you drive to the first patient, they will pay you for mileage from the office to the first patient. Now, how much they pay for mileage is another thing. In my experience, they pay between 50 and 65 cents per mile. Um, but you should always, I feel like you should ask, if they don't offer to pay you mileage, ask them if they will reimburse you for mileage. And I think that's it for this video. These are the things that I would keep in mind and look for in my contract if I was going to take a home healthcare contract, and also most likely negotiate before I decide to take the contract. You kind of have to make sure it's going to work for you, because remember, you're out there alone. You're making decisions on your own. You're making phone calls to get resources, report things to the doctor. You're driving through rain, through snow, through windy days, through fog, through bad weather, good weather. You're driving to places where you don't know if you're going to be safe. You don't know what's going to happen when you get there. So it's important to look at your contract, see where you're going, how many places are you covering, and most importantly, how much am I going to get paid? You want to make sure that it's going to be worth your time. If I'm spending extra hours working, will you pay for those hours? um I feel like these things are important. It's important to ask, it's important to know, so that you can make the best decision for you and your family. All right. Or if you don't have a family, for you. Thank you for watching. I hope this video helps someone. Please like, share, and subscribe, and I'll see you in my next video. Bye bye now.